You, Toy. Well, hey, this morning's Ask the Doctor segment, we are talking about menopause, but also what's called andropause, also known as male menopause. Joining us now is Dr. Mia Cowan. She is of Mibella Wellness Center, and she joins us now to talk about that. Dr. Cowan, good morning.
Good morning. Thank you for having me.
I do want to make sure I had the, how do you pronounce the wellness center where you are?
Mibella Wellness Center.
Mibella, okay. All right, so most of us, and some of us, have already gone through menopause, myself included. But for those who haven't, explain what happens during menopause.
So during menopause for women, the hormones start to decline. And as a result, a lot of women will start to notice weight gain, fatigue, hot flashes during the day, night sweats, problems with sleep, weight gain in that abdominal area, more irritability, decreased focus and memory, and decreased sexual function.
There we go. Some people have severe symptoms, some do not. So what are typical symptoms?
Good question. So as far as severe symptoms, some women are at the point where they're at a nervous breakdown, their moods are completely off, it's affecting their relationships, they're having hot flashes all day long, and that causes more anxiety, they can't control it, and they're not sleeping. And then some people may notice a few mild symptoms, like they may have a hot flash here, a night sweat there, some nights they don't sleep well, they notice they're a little bit more irritable, but everything is tolerable. So you're right, it can go from very mild to moderate, where you don't even know you're going through menopause, all the way up to severe, where you need to see somebody right away.
Do we know why women react differently and their bodies react differently to it?
Well, hormones, everybody responds differently to hormones, and some women need more than others, as well as men. Some men need more than others. So the symptoms don't directly correlate with a number or a lab value, but for some women, they have severe symptoms even with minor changes in their hormones.
Okay, you mentioned men, so let's talk about what is it pronounced andropause, male menopause?
Menopause. So what we do know is that with aging, everybody starts to have a decline in hormones. For women, that's testosterone, estrogen, and progesterone, and for men, that's mostly testosterone. So when testosterone starts to decline for men and women, they start to notice the night sweats and the weight gain and the decreased stamina and the decreased sexual function.
Why is it that we haven't talked about it in that way up until recently? Because it's always been women who go through menopause. You never heard about men. But do all men experience something, or do they just think it's a part of aging?
And that's what a lot of women do too. Yes, most of us think it's a normal part of aging to be tired all the time, to be more irritable, to not sleep, to not want to have the desire for intimacy. We've come to find that as the normal aging process. But the good news is that we can actually replace those hormones and get rid of those symptoms to improve quality of life and health.
All right, let's talk about the hormones. Is it safe to take hormones? And I would imagine not everyone certainly needs hormones. It depends on what you're going through and what you're dealing with, right?
That's exactly right. So estrogen and progesterone are a different conversation. Some women cannot take them if they've had breast cancer or a blood clot. As far as testosterone goes, I call it the forgotten female hormone. Anybody can take testosterone, especially in the pellet form, where it's plant-based and bioidentical. Unless a man has prostate cancer, we would not give it to him. So most people can take testosterone. Estrogen is a little more controversial, and you have to qualify for that. But we do know that with testosterone replacement alone, it can relieve most of the symptoms associated with menopause and andropause.
Do women or men see immediate changes and can kind of get back to what they used to be, not dealing with the night sweats and those type of things?
Yes, the good thing about pellet replacement is it's specific and it's individualized for each person. So usually when they get their first treatment, we get blood work 4 to 6 weeks later, see how they respond, and we're going specifically by their results, their symptoms, and it's designed specifically for them.
Well, it is certainly something, if you live long enough, everybody's going to go through it, so we all have it in common, right?
That's right. That's right. And we know that testosterone also improves health. It protects the heart, protects the bones, decreases the risk of dementia. It's also breast and prostate protective, and that is the plant-based bioidentical testosterone. The synthetic testosterone can increase the risk of heart disease for men.
Okay, we're out of time, so as we wrap up, I think the message is talk to your doctor if you feel like you're having something that you're worried about, right?
Yes, if it's not normal, it's not normal. See your doctor.
Dr. Mia Cowan, thank you. It's good to see you today.
My pleasure. Thanks for having me.
Now here's JJ.